People talk about eggs like there are only two possible labels: heart poison or perfect food. If someone eats eggs most mornings, what is the sharper question? Are eggs raising cholesterol, or what are they being eaten with and replacing?
That is the sharper question. Egg yolks bring dietary cholesterol plus protein, fat, choline, and micronutrients. But LDL in the bloodstream is controlled by more than cholesterol entering the mouth. The liver makes cholesterol, packages it into lipoproteins, clears LDL particles through receptors, and responds strongly to saturated fat intake. In a 2025 crossover trial, saturated fat tracked with higher LDL. Dietary cholesterol did not show that same relationship. The design matters. Participants rotated through diets for 5 weeks. 2 eggs per day with low saturated fat, an egg-free high saturated fat diet, and a high cholesterol high saturated fat control. Compared with the control, the 2-egg low saturated fat diet had lower LDL by about 5.7 mg/dl. That does not prove eggs lower risk by themselves. It shows the surrounding fat profile can dominate the cholesterol story.
But that trial also mentioned LDL particle shifts. If total LDL goes down a little while small LDL particles go up, how should a normal person read that without pretending they are a lipidologist?
Read it as a reason for humility. LDL cholesterol remains an important cardiovascular risk marker, but particle details remind us that a short feeding trial is not the same as proving fewer heart attacks. The umbrella review found weak and heterogeneous evidence overall. Some meta-analyses linked eggs to small lipid changes, but evidence was not robust enough to generally discourage eggs as part of a healthy diet.
What about someone who already has high LDL and is trying to eat heart healthy? Is there evidence for eggs inside a DASH-style pattern, or is that a leap from healthier adults?
There is some evidence, but this is where individualization starts. In a randomized crossover trial of adults with hyperlipidemia, 2 eggs daily in a DASH diet for 8 weeks did not significantly worsen LDL, endothelial function, blood pressure, CRP, or glycemic markers compared with DASH without eggs. Still, people with familial lipid disorders, very high LDL, diabetes complications, established cardiovascular disease, or medication changes should not use a podcast rule as their treatment plan. For best-fit users, eggs are practical protein and a concentrated choline source. In the DASH trial, adding eggs increased choline intake, while carbohydrate intake decreased because foods were displaced to keep calories stable. That is the realistic benefit: satiety, protein, and nutrient density in a meal pattern. It is not evidence that more yolks automatically improve arteries.
So the better home experiment is not add eggs to everything. It is, what did breakfast become? If eggs replace a sugary cereal for one person but replace beans and vegetables for another, those are different experiments, right?
Exactly. The food matrix is protein, fat type, fiber from the rest of the meal, sodium, calories, and cooking fat. A boiled egg with fruit and oats is not metabolically identical to eggs fried in butter with processed meat. The controlled trials are really warning us to stop isolating egg cholesterol while ignoring saturated fat, energy balance, and the rest of the plate. Product claims need the same discipline. Hens can be fed diets that change yolk fatty acids. A 2025 meta-analysis in laying hens found microalgae increased yolk omega-3s. But changing an egg's fatty acid profile is not the same as proving human disease prevention. In a small human cracker trial using PUFA-enriched eggs, fatty acids changed in blood, satiety improved, but waist circumference and cholesterol did not improve over 70 days.
That sounds like a useful distinction. Absorption can be real while the advertised outcome is still unproven. How should viewers judge a carton that says omega-3, fortified, pasture, or heart healthy?
Use outcomes you can actually verify. If someone changes egg intake, keep the rest of the diet stable enough to interpret, then recheck a lipid panel on the timeline their clinician uses, often after several weeks. Watch LDL-C, non-HDL cholesterol or ApoB if measured, blood pressure, weight trend, and what breakfast displaced. If the marker worsens, the body answered better than the internet did.
What about the choline to TMAO concern? I hear that eggs feed gut bacteria that make TMAO, and TMAO is linked with cardiovascular risk. Is that a reason everyone with metabolic syndrome should avoid eggs?
Not on that evidence alone. A small randomized crossover meal study compared 3 hard-boiled eggs with meatballs in people with and without metabolic syndrome. Metabolic syndrome participants had trends toward higher TMAO-related responses and 30 to 50% higher urinary TMAO excretion, but plasma differences were not statistically significant. The authors called it exploratory and needing larger validation. So it is a flag for context, not a standalone diagnosis. The boring safety details still count. Egg allergy is a clear avoidance issue unless an allergist gives specific guidance. Food safety matters because undercooked eggs can carry infection risk, especially for pregnant people, older adults, infants, and immunocompromised people. And if a clinician has you limiting yolks because of a specific lipid disorder or treatment target, do not replace that plan with a generalized trial summary.
So the answer is not eggs are back or eggs are banned. It is keep saturated fat low, know your baseline risk, count the whole plate, and verify with labs if cholesterol is a concern. Is that the most honest carton label?